Hi, I'm Dr. Justin Coffey, Chief Medical Officer at Workit Health and Professor of Psychiatry at Geisinger Commonwealth School of Medicine. Here at Workit, everything we do begins with our mantra, patients as designers. Our philosophy of care is to combine the power of technology on the one hand with the expertise of our patients and their lived experience on the other hand. We believe that if we listen, really listen, our patients will tell us everything we need to know. It's a simple approach, really, and it's very powerful. Let me share just a few examples of what that looks like. First, Workit was the pioneer that brought addiction care online, and that was way before COVID hit. Our virtual first approach to care was motivated really by three ideas from our patients. Number one, care that is easy to access. This is especially true for people who live in rural areas or the many places in our country today where there's a shortage of appropriate providers. Number two, care that works. In other words, we're only going to adopt a virtual first approach if the care that we deliver using telemedicine is high quality. And number three, care that is free of stigma. We want the experience of receiving care with us to be free of judgment and shame. The inspiration of our virtual first approach achieves all three of these goals, and we're really very proud of that work. A second example of our patients as designers philosophy is how we've developed technology to ensure that our patients receive the best care based on the best evidence. At Workit, we know the science of treating addiction, and we know that not everything that works is always easy. But our patients deserve the best, and they help us design ways to deliver it. With opioid use disorder, for example, we know that the safe and effective use of buprenorphine cuts the risk of dying in half, by 50%. So we figured out ways to prescribe this life-saving medicine easily and electronically right to the local pharmacy of folks who are accurately and carefully diagnosed with opioid use disorder. We also figured out ways to make urine drug screens painless and shameless. And again, this innovation was another brainchild of our patients. A third example of our patients as designers philosophy that I'd like to share relates to the fact that substance use disorders are illnesses that rarely exist in isolation. In fact, over half of people suffering from a substance use disorder also suffer from one or more related health conditions. These include psychiatric conditions like depression and anxiety, as well as general medical conditions like hepatitis C or HIV. Our patients have made it clear that they want whole person care. They trust us to provide world-class care for their substance use disorder, and so we make every attempt to provide world-class primary care for their related health conditions too. Our providers find this whole person approach really gratifying, mainly because it just feels like the right thing to do. So these are three examples. They're just a few of the ways that Workit is unique. They all started with our patients, putting them in the design seat. Now, let me be clear. When I say patients as designers, that does not mean that we abandon patients to their own autonomy. What it does mean is that we bring their design thinking to the same design table where our clinical experts and technology innovators are sitting. It's a partnership. That partnership produces an amazing experience for our patients. And it's that partnership that we think is the secret sauce at Workit Health.